My name is Jacqueline Gilstrap. I consent to being in this video.
Good morning, Miss Gilstrap. My name is Kelsey. I'm going to be your nurse today. Can you just confirm your name and your birthday for me?
Jacqueline Gilstrap, June 2nd, 1998.
Okay, awesome. So I'm going to pull the curtain for privacy. To maintain dignity, I'm going to perform some hand hygiene. So I'm just going to be doing a quick postpartum assessment on you, if that's okay.
Yeah.
I'm going to be touching you throughout some of it. Is that okay with you?
Yes.
Okay. So the birth history has been obtained. She had a vaginal birth. Right now I would do a full set of vital signs. They're within normal limits, so I'm going to proceed with the examination. So first I'm going to be examining your breasts.
Okay.
So I'm going to have you pull the gown down. Are you breastfeeding or bottle feeding?
Breastfeeding.
Okay. So with breastfeeding, we would be looking for any cracks on the nipples or the areola, bleeding, ulcers, dryness. I would also be looking for signs of mastitis, which would be like redness and warmth, and then engorgement. And then I would palpate for engorgement as well, which I'm not going to do. And then I'm going to move on to your uterus. So I'm going to have you, you can put your gown back on. I'm going to have you lay back for me. And then I'm going to be touching you. Is that okay? Mm-hmm. So to palpate the uterus, you would find the pubic bone and then kind of brace the uterus with the C of your hand so that it doesn't prolapse through the vagina. And then I would start at the umbilicus and palpate for the fundus of the uterus. At this stage postpartum, it should be about in line with the umbilicus. And then per day, it should descend about 1 centimeter or 1 finger breadth. So it is firm. If it was boggy, I would massage it until it was firm. And it is also midline. If it was deviated, that could mean that her bladder was full. Speaking of bladder, have you had any issues urinating since you gave birth?
No, ma'am.
You have been able to urinate since
Yes.
Okay. Any abnormal colors, odors?
Nope.
Pain, anything like that?
Not that I've noticed.
Okay. Have you had a bowel movement since you gave birth?
Yes.
Was it firm? Was it too firm?
Yeah, I kind of felt I was pushing a kid out again.
Okay. Would you be interested in a stool softener? I can ask the
Please.
Okay, I can ask the doctor for that for you because we don't want you to be uncomfortable. Any other abnormalities with your bowel movement?
No.
Okay. Let's see. And then next would be lochia. So I would examine the pad. There are 3 stages of lochia: lochia rubra, lochia serosa, and lochia alba.
Okay.
At this stage postpartum, it should be lochia rubra, which is bright red, with like up to the size of a quarter clots and tissue. So I would document what stage it was in. How often would you say you've been changing your pad?
Every couple hours.
Okay. So if you notice that you are saturating through about a pad an hour, please let us know so that they can check you out. And then next would be episiotomy or laceration. So per the chart, she did have a little bit of tearing. So I would have you lay back, open your legs so I can inspect your perineum. Is it okay if I do that?
Yes.
So I'm looking for redness, erythema, edema, discharge, and approximation. Your stitches look like they're approximating well. There's no abnormal discharge, no like it'll be a little bit red, but not like excessively red. Mm-hmm. And then, let's see, you can sit up now if you would like. Okay. Sorry. And then H is Homan sign, which they don't really do anymore, but it would just be inspecting and palpating the legs for DVTs or blood clots. And then E, emotional state. Do you feel like you're coping well?
Yeah.
You have a good support system?
Yes, my mom was here with me all night.
Awesome. Okay. The baby blues are completely normal, but just let us know if it feels like it's too much.
Okay.
And then R at ROGAM, If mother was Rh negative, we would follow up on that to make sure that she got the follow-up medication for that, to prevent complications in next pregnancies. Okay, so that concludes my exam.
Okay.
I'm gonna put the bed in the lowest position. I'm gonna give you your call light. Do you have any questions for me right now?
No.
Okay, just please let us know if you have any questions. I'm gonna perform hand hygiene and then go document my findings.